The most important role that AHA plays is empowering the common person with the knowledge. See, your educated patients are your best patients. And in order to win a major problem, and cardiovascular disease is the #1 healthcare problem in this country. When you know that every 40th second there is an individual who dies from cardiovascular disease, it's a huge challenge. And to fight this challenge, you need knowledge.
The American Heart Association provides good public awareness, provides good training programs to the public and awareness to get people to call 911 and recognize these emergencies. And it also provides good guidelines and training for our first responders and our EMS providers as well.
American Heart Association supplies us with standards, technology, progressive developments, provides us with a training network, allows us to teach vast numbers of people in emergency cardiac care of all disciplines, but most importantly, emergency cardiac care when it comes to basic life support.
It's because what happens out in the field. Does the patient understand the risks, or does the patient understand the symptoms of heart attack? Now that's AHA.
There are 83 million survivors of heart attacks or strokes in the United States alone. That's an amazing figure. So we've gotten 83 million people through their strokes, through their heart attacks, through guidelines that have been developed by the American Heart Association.
You know, we do not realize what an impact it has in the development of surgical techniques, temporary pacemakers, permanent pacemakers, artificial heart valves, as well as, you know, giving us guidelines in providing treatments for patients with high cholesterol, you know, educating patients, making better and healthier lifestyle choices.
When the patients own their risk, when they are empowered to understand where the problem is, I think that's when you beat the system.
I've had patients who've come in and they have survived their out-of-hospital cardiac arrest only because there was bystander CPR that was provided for them.
One of the things I've seen firsthand is the public CPR. I've seen patients that have come to the local ERs who have had public CPR done on them, utilizing the AEDs, and they have survived and been talking when they were virtually dead in the field. And that's all because of the education and research through the AHA.
The tremendous effort made by the American Heart Association to educate patients has paid off in many, many ways. Not only are patients more aware of what the risk factors are and what they need to be doing, what's their responsibility to really take care of their cardiovascular health. So that helps the physician, of course, tremendously.
Women always feel that it's a men's problem, and it's totally opposite now. It used to be in 1980s, but now women actually have higher cardiovascular disease than men at the same age group. And again, how do you fight that? Is to let the women know that it's not the breast cancer or the ovarian cancer, but it's the cardiovascular disease, which is the #1 problem as far as your health is concerned.
For people to recognize what is happening to them. Is this really a heart attack? Am I having a stroke? You know, oftentimes women don't get the classic symptoms, but I've had women come in and I would say, what was it that tipped you off? What made you even think that this could be a heart attack? Because you weren't having crushing pain, you felt sweaty and nauseous. And I've had people tell me, you know, I didn't know what was wrong with me. I just knew something wasn't right. You know, I listened to my body, and I say, it's thank goodness that you got here when you did.
And I see in the emergency room patients who did not have typical heart problems, but they say, you know what, we know that women don't have to have the same kind of chest discomfort that a man has. I was feeling this unusual sensation, I was feeling nauseous and my back was hurting, but it was unusual. And I knew through AHA that could be the symptom of heart attack. Well, actually they did. And a life is saved.
I would say when I first started practice, we'd say a person that had a heart attack, it wouldn't be much longer. They'd be back again with another problem and another problem and another problem. We now know, and we now also have the tools to treat those patients so aggressively that we can suppress that in many cases and prevent that second or third heart attack. There's no question in my mind our community has benefited tremendously from the efforts of the AHA. The research, the education, You know, you might find it interesting to know that there have been 8 Nobel Prizes awarded to researchers whose research was initially funded by the American Heart Association. That kind of advancement of science, that kind of knowledge that then gets passed on to physicians and then the education to the lay public tremendously helps the community.
With the American Heart Association, I think we've come a long way. It's made a tremendous impact, again, on just simple lifestyles in the public, with the public, as well as, it helped lawmakers and policymakers in advocating and making changes which would improve and protect the lifestyle as well as the health of the community.
The Peoria area, without the American Heart Association, would not have the standard of care that it has now. Pre-hospital, public awareness, in-hospital standards, research that they do has all improved quality outcomes for the patients.
So there's an entire array of reasons why people really ought to be financially supporting the American Heart Association, ranging from just the simple things of just educating the lay public to understand what's going on and to what they can do to improve their own cardiovascular health, and maybe even to help a person who's in need, who may be having a cardiac arrest and needs CPR, all the way to the most cutting edge science. What does the future look like? And one of the exciting goals of the American Heart Association is to reduce death from cardiovascular disease and stroke by 20% by the year 2020. That's something we're all working for, we're excited about, and we think it's a doable goal.